Okay, well, ladies and gentlemen, my name's Dr. Jake Lavere. We're going to be talking about shin splints, how to avoid, how to affix, and how to tape accordingly. And shin splints are funny. They're an overuse injury most of the time, and I see them quite a lot in runners. Okay, so you might have somebody who runs a lot, and about a mile and a half in, they start getting this tender pain in the shin. And over time, that tender pain can become worse and inhibit the simple things as just moving around in your daily life. So what I want to talk about is how that actually gets developed. And we talked earlier about gait and how that is a balanced sport, but when you walk, you always have 2 feet on the ground and then 1 foot on the ground. So you have some double support to single support, so you have better stability. When you pick up the pace and you start running, what happens is you're all single support, so it becomes the ultimate balancing act, and as you do that multiple times, consistency is of value. So we're creatures of habit. As we fatigue or we carry on as running, we will lean to one side or the other, whether outside of the foot, inside of the foot, and go to our most comfortable aspect. And first we have to identify what that comfortable aspect is, and so we know there's a deficiency, because if we constantly run on our comfortable side, that's going to develop musculature differently. If musculature develops differently, you're going to cause imbalance. Imbalance eventually causes a future injury. And so training is all about timing, balance, and coordination. As you go into an injured state, you're actually falling away from that. And so what I want to do is I want to be able to put together some easy things that you could take a look at and test yourself, and the test becomes the exercise becomes the test. So the first thing we're going to do is we're going to use, I usually like using a slant board, but we're going to make shift, and we have the lily pad, so to speak, but a nice TheraPad stabilizer. What I want you to do is I want you to put your foot here to where it just kind of angles, okay? And we're actually going to go up on 1 foot, and I want you to do the inside, and then you're going to carry over to the outside. Okay? And basically what we're doing is we're putting her foot in either supination or pronation. Okay, so this is supination, all right, and you're gonna lift that other foot and we're gonna balance. All right, and you can see that she's a little bit unstable going that direction. Okay, so now we're gonna put her foot on the outside of the pad, and we're gonna do the same thing. We're gonna see what's more comfortable for her. All right, now she's able to correct a little better on that side. That's pronation, okay? So which tells me that she probably spends a lot of time more on the outside of the foot when she starts fatiguing than the inside of the foot, right? Now let's test the other leg. So yep. And so we're first gonna go into pronation, all right? And still, same thing. Very nice. I'll go into supination. And she has a hard time there. Okay, so she favors pronation compared to supination. All right, so the great thing about balance is you can't overtrain. You can't overtrain balance. You can constantly practice it, and you can do it several times a day, because what we want to do is we want to increase the signaling that the sensories come into the brain. The brain says, this is what we want to do, and it coordinates the muscles accordingly, right? I always say muscles are kind of stupid. They're pulley systems. They're being told what to do, so we could train them to work properly. We don't want to grow asymmetrically and cause muscle imbalance, because of course that's going to cause an injury at some point. Okay, so let's say we identified that she's going to work on this for however long it takes to where she feels comfortable on both sides, all right? So now what we're going to do is we're going to tape this, and I'm going to show some exercises of how to actually strengthen and promote non-injury exercises. All right, so go ahead and have a seat for me, and we're going to go ahead and take off this shoe. All right, you really have that on there. I'm going to let you do that. Okay, so a common shin splint injury is actually an overuse of the anterior tibialis. Now, the anterior tibialis moves the foot in dorsiflexion. All right, so when we run, if we have a hard time and this starts becoming fatigue, guess what happens? When we drop that heel down, this either eccentrically falls or drops, okay? which means this muscle is slowly becoming weak and doesn't have the strength to be able to keep up that motion. So eventually something has to give. What I want to do is I want to give some support so you can carry on throughout the day without pain, and we can work on proper biomechanics. Okay, so what I want to do is I'm actually going to push you in a little kind of provocative position where we're going to cause just a little bit of pain. And so I'm going to use this, okay, and I want you to hold on as best you can, and we're going to put you in the opposite direction, so you're going to be just like that. I'm going to tape right around you. All right, and when I do this, I always round the edges, okay? So that way it doesn't fray at the end, and when I apply the tape, I don't put any tension on the tails, which is the anchors here. All right, I'm just going to place it. It's on the lateral aspect. All right, and I'm going to use just 25% tension, and I'm going to come up and over, just like so. All right, and what I want to do is just give a little support. Now, what I want to do is I want to find out where the focal point of that pain is, and I'm just going to do what's called a decompression strip. So I'm just going to do, it's going to be 100% tension right across that area. And what that'll do is work as what's called gait pain theory, where the brain can only take in a certain amount of signals in a certain area. And it's going to eliminate some of that pain. And so 100%, right there, over, all right. And of course, when we do this, we test before and we test afterwards, because we want to see what the pain level is before and test afterwards to see if we did any good. If we didn't do any good, then what therapeutic value did we actually apply? All right, so method of actually doing this, you're going to press up, 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 up. All right. Any pain? Okay, so let's say the pain was a 5 out of 10 before, now it's a 0 out of 10. We know we're on the right track. Okay, so now what I want to do is I want to do just some simple exercises that's going to promote proper ankle function. All right, so you can go ahead and stand up, put your shoe on if you want. Okay, and this might be an exercise you might want to do at home because it's going to make you look kind of funny, but it's going to do wonders. So, let me get this around one foot, get this around the other foot. Okay, and when I train, this is going to go across and up. All right, and lift up. When I train, anything that you could do very, very slow, you could always increase speed, but I want fluidity. So if you slow this down and become very fluid, then as you pick up pace, you're gonna be more consistent. So we're just gonna do a normal small little walk, okay? And you're gonna go nice and slow, and I wanna see that foot, yep, straight ahead, good. And then the other foot, good, okay? And then once you do the next step, we're actually gonna go backwards. Okay, and now walk backwards for me. And because she's able to go very slow and fluid, she's making sure that her movements are very concise and the particular muscles are working the way they need to. All right, so the next one we're gonna do is we're actually gonna put the toes in. So you're gonna do, yep, and you're gonna do the same movements. Good. And so over time, what we did is we first figured out what the mechanism of injury is, why it occurred, how to correct it, and then how to prevent it. And that's mainly what we're trying to do. And we're using the tape to facilitate decreasing the pain and function. So eventually, we don't need a Band-Aid to carry on. We could actually go do our sport or wherever we're trying to go do with full motion and full confidence that we're not going to get injured again.